people with different backgrounds and conditions, as we talked about for menopause and estrogen, have to be careful, because when you're starting to modulate hormones, you're starting to modulate not just the tissues that thrive on binding of those hormones, but remember, the reason why there's so much breast cancer and there's a reason why there's so much testicular cancer is that any tissue that undergoes rapid reproduction of particular cells, so there's a lot of reproduction of cells and shedding of uterine lining and the reproduction of cells and eggs in the ovary, and in the testes, there's the production of Leydig and Sertoli cells, and there's this kind of ongoing production of sperm. That's why those tissues are particularly vulnerable to the development of cancers, and many of those cancers are androgen sensitive. That's why one of the major treatments for prostate overgrowth or prostate cancer is to give anti-androgenic drugs. It's really about trying to prevent testosterone from encouraging growth of tumors. So I want to, really emphasize the caution there, because it's easy when thinking about optimizing estrogen and testosterone to just think, oh, more is better. More is definitely not better. Any tissue that recycles itself is prone to cancers, and those tissues thrive on androgens and estrogens to create more tumors. So you have to be careful anytime you're modulating hormones, especially androgens and estrogens. And while we're talking about supplementation, the effects of supplementation, I would say in some individuals can be quite dramatic, but they're always, except in extreme cases, going to be far more subtle than would be, for instance, just injecting testosterone or injecting estrogen, etc. So I think we should just be honest and upfront about that. So thus far, in terms of talking about optimizing hormones and in the discussion of supplementation, I haven't really talked about things that actually affect the brain directly, that increase the pituitary output and things of that sort. We've mainly been talking about things that free up testosterone or that increase estrogen at the level of the periphery. But if you remember way back to the beginning of this episode, hormones are made in different locations in the body, and there are hormones that promote the release and the production of hormones from other tissues in the body. And one of the main hormones for that is luteinizing hormone.